Hey guys, welcome back to my channel, and if you're new here, my name is Kristina. In my videos, I talk about a plant-based diet and nursing school. If you like these types of videos, please like this video and subscribe down below. In today's video, I'm going to be talking to you all about health assessment and how to pass during nursing school. Let's get into it. So at my school, I had to take this during my first semester of nursing school, and we had to use this textbook, which is the Jarvis. So mine was the 8th edition physical examination and health assessment. So as the title says, it's pretty much a class about how to do a physical examination and how to assess the body of, of course, a patient that you see in the hospital or wherever you may be. So I'm going to give you some tips and tricks on how you can do well in this class and an easy way to learn the concepts. So the first thing that we had to learn in this class is the basics, which was just understanding the different vital signs and what you have to know in order to treat a patient. So if you're trying to see if a patient is sick or has some underlying conditions, then you can tell by their vital signs and how to assess them properly just by looking at key things like respiratory rate, their blood pressure, their temperature, and their heart rate. And also another one that's super important is their O2 saturation or their oxygen level. So those key concepts are really important to understand when you're taking this class, because I know that there's ranges for each of them, but sometimes you'll have a situation where those ranges will all be out of whack, and you need to be able to assess the patient to see exactly what's going on and what is the priority action to do in order to help this patient. So throughout this book, it talks about the different parts of the body and how you would assess it. So for example, when you're talking about the physical examination part, it goes over skin, hair, and nails. So when you open up that section of the book, it's going to be talking about every fine detail about skin, hair, and nails, and it will get very overwhelming on what exactly should you know for your class. So the way that I tried to study was basically, instead of looking at what means normal, I looked at what meant abnormal. So what I mean by that is you want to look at the different parts of the body and see what makes this person abnormal. What shows that this person is having an episode of, let's say, hypoxia, meaning that they're not getting enough oxygen. So you want to see things like they have blue extremities, or maybe they have blue lips, or something like that that will cause the patient to have certain hypoxic features. So those are the things that I looked at over the course of each chapter in order to determine what would make this patient abnormal, or what would I need to assess or look into further to see what is going on with them. So this sort of approach can be done with each topic. So anytime you are given certain chapters to go over, instead of just learning, like I said, what to know about things that are normal about a patient, look at the things that are abnormal. Look at the things that stand out. So for example, if you're looking at someone's ear and you see that it is red instead of being like a pink color, then maybe you would know, okay, maybe they have an infection going on, or maybe they have some sort of irritation, or something's blocking, like a buildup of earwax or something like that. So you need to know these things in order to assess a patient properly. So each of the topics or each of the sections throughout the book is going to show you everything that is normal. Your goal is to take notes on the things that are abnormal, so when you are tested on it, you'll be able to identify which things you shouldn't see on a patient. And if you know the things that are abnormal, then you'll also know the things that are supposed to be normal. So you could even make like a column. You could even fold a piece of paper in half and say, let's say skin, hair, and nails. You can go over on the left-hand side and write down everything that's supposed to be normal within that patient, quote-unquote normal. And then on the right-hand side, you could write down things that are key for that specific area of the body that are abnormal. And this will help you analyze the patient easier, and then when you're tested on these different things, you'll be able to identify them way easier. There are also key things that you want to look at between adults and children. So of course they are different because there are different stages developmentally throughout the life. They are still growing as children, and even as adults they're growing as well, but it's completely different. So when you're going to assess a child, you want to make sure that you know the differences between how you would do things for a child versus an adult. For example, when you're looking at a child's ears, you want to make sure you pull the pinna down and back, versus an adult it would be up and back. So those little things, even though that they're so small and minute, when you're going to assess a patient, you want to be able to know these things, and you definitely will be tested on them, so it's so important to know. So again, you can make a column that says pediatrics versus adults and just make the key distinguishers between the two. Not every chapter is going to have those key distinguishers between the two, because a lot of things are similar, but there are things that are different, and those are the things that you most likely will be tested on. One of the biggest things that I remember about this class is that we really needed to know how to assess a patient's pain level, because pain is so subjective, meaning that it's so different from patient to patient and how they perceive pain or how they feel pain. So it is your job to make sure that, one, you're not judgmental to the patient and how they're feeling, and two, you make sure that you really understand what they're saying or what they're trying to get across. So make sure that you are listening actively, and let's say this is just a mock patient. You want to make sure that you understand how they're feeling. So there's different forms and scales that we use to help understand or communicate their pain level. So for children, for example, it is different. You would give a child a face scale, and basically it shows one of those scales where it will say on the left side it'll show the different faces. So it'll show, like, let's say a face that's grimacing or unhappy, and then it'll go to like happy, or it'll start out happy and then go the other way. So a child can easily point at that and say, this is how I'm feeling, versus trying to verbalize if they are shy or can't communicate properly yet. Whereas an adult, you wouldn't give them that sort of scale unless they were an elderly patient and had trouble communicating as well. You would want to provide them with something else, like we use the numerical scale. So you would say, out of 0 to 10, with 10 being the worst pain that you've ever felt in your life, what is your pain level? And that way you give them a chance to describe how their pain is from a number standpoint, and then you could go into further detail what type of pain they're feeling. So you would ask, where is the pain? Is there anything that you do that makes the pain worse? Is there anything that you do that makes the pain better? Now, if they're taking any medications or anything to help alleviate this pain, you want to ensure you know what sort of medication, how often they're taking it, and you go further and further and investigate on what sort of pain they are having. So you want to gather as much information about this pain, location, the intensity of it, trying to describe it as best as possible, because again, if there are two people side by side and they're both having appendicitis, for example, they could be having two different levels of pain. It's not necessary to say that they'll both have an 8 out of 10 of pain. Everyone perceives pain differently, so therefore you need to be non-judgmental, and you need to make sure that you are listening carefully to the patient so that you can ensure that they are able to get the proper medications that they need or the proper treatment that they need. Another thing that I recommend is you might have to be tested on exactly how to do a head-to-toe assessment. So I physically had to do one to another classmate in order to show that I understand how to do an assessment properly. So what I mean by that is that I had to pretend like I'm going to a patient's room and doing a full body assessment. So that's head to toe, because you're going from the head and you're going down to each segment of the body to assess them and to see if there's anything that is going on, to gather information to understand the patient a little bit better. I highly recommend that you write down all these concepts when you're going over a head-to-toe assessment, because when you're trying to actually do a head-to-toe assessment, you need to have some sort of guideline. There are so many different parts involved, so it can get very confusing or you can miss something, but they're all super important in their own way, because it's like having a missing puzzle piece. You need to have all the pieces in order to have a complete puzzle. I definitely recommend doing that. You write down everything from head to toe on what you would do to assess a patient. That will not only help you with your testing, but it'll also help you if you have to do an actual head to toe assessment on a classmate or do a video or something like that. One other thing that I did want to mention is that you are going to have to know the different tests and strategies to accommodate the elderly. So now this is a large population and there are so many tests to understand what is going on with them and the aging process and what sort of things happen or slow them down. So there's going to be different changes in an older adult, and obviously it doesn't happen to all of elderly patients, but it does happen. So for example is when you have a patient that starts getting older, sometimes they will hunch their back. So they will get kyphosis, and therefore you will see the curvature go like that. So that's why you see like the older ladies, they kind of like bend down like that. So that is a distinguishing feature, and also it will go into things like what sort of assistive devices do these patients need and what sort of things could help correct their alignment to help this as well. There are also other tests that are super important to know, like for example their hearing. There's one test that's called the whisper test, where you are able to whisper in a patient's ear and then you're able to see if they're able to hear it. Those are really important to gauge their level of hearing, and they even have the standardized test for eyesight. So to test for eyesight, they have those standardized tests like the Snelling chart, which is just that simple chart at the eye doctor's office where it has the different letters and the eye doctor tells you to read off the letters. So things like that are important to keep in mind for adults and for all populations like pediatrics and adults and elderly especially, to see if they have proper vision and proper hearing. I hope you guys enjoyed this video, and like always, if you have any questions at all, please feel free to leave a comment down below, or you could always send me a message on Instagram. And if you have any questions or if you want to see a future video, please let me know. I can't wait to see you guys next time. Bye!